Now, let's not forget we are looking at drug classification, chemical structure, two, pharmacological action, three, therapeutic use. Okay, therapeutic use. This pharmacological action and therapeutic use can actually be classified together. Okay, four, mechanism of action, where and how this drug work. Okay, then five, legal status. Is talking about legal status now, we will now ask ourselves, is this drug a prescription drug? Can this drug be given or prescribed by anybody? Can it be dispensed by anybody? Does it need strict regulation for it to get to wherever whoever is to get to? So those are things we put into consideration. And the last part there is the source of origin. Where is this drug gotten from? Is it a plant source? If it is from plant source, you are looking at the botanical name and the likes of the drugs. If it is from chemical source, you're looking at the chemical structure and the other. You may be asked to classify drugs. They could give three classification and give examples of each of this classification. Let's assume you are asked to give a classification based on therapeutic action. You know what to give already. If they say give example based on chemical structure, you should be talking about the beta lactam antibiotics. You should be talking, but remember, classification based on chemical structure, that have to be do with the beta lactam antibiotics because of the beta lactam, the chemical talking about there is the beta lactam. Okay, we have the benzodiazepine. Now that benzodiazepine is the structure, the all of them are inside that benzodiazepine structure. So you have the diazepam and the lorazepam as part of the examples there. Then the beta lactam antibiotics, you have the penicillin, the cephalosporins. They are examples of the beta lactam antibiotics. Then just used in the therapeutic use. Okay, is an example of classification under therapeutic action. Therapeutic action is what does the dog, the classification under treatment. Therapeutic have to do with treatment. Classification under treatment. Now when you say classification under treatment, example of drugs under it is one, anti-malaria. Is as simple as that. It is used to treat malaria. So example of anti-malaria, you have the artemether, you have the lumefantrine, you have the quinine from the previous class we had already. Then under therapeutic use as well, you have the antihypertensive. Is as straight as that. Antihypertensive used in treatment of hypertension. Anti-malaria is used in treatment of malaria. You have the amlodipine, you have the losartan. Okay, so these are examples. Still under that class, you have the anti-diabetics, drug used in treating diabetes, and a good example there is the metformin. You have the glimepiride. Those are drugs used in treating diabetes. Okay, then looking at other example there, you could have antibiotics, drug used in treating bacterial infections, used in treating bacterial infection. Don't forget, we're still under the therapeutic use. So a good example of antibiotics is the amoxicillin, ciprofloxacin, and other antibiotics you give. So in all of this, ensure you get minimum 5 examples in your notes. Thank you very much.
Okay, legal drugs are drugs that can be produced, sold, and used legally only by health practitioners. Only by health practitioners. In under these legal drugs, we have the OTCs, which is over-the-counter drugs. These are drugs that you can get from anywhere. All right. These drugs include your regular painkillers, paracetamol, ibuprofen, and your antacid, and these are few drugs that you find under the OTC. Then the other set of drug is the prescription only drug. This one requires prescription from a doctor. Okay, example of these drugs include your augmentin, which are amoxiclav, your anti-diabetic drugs, because the doctor must have seen the patient before writing this drug. Even your anti-hypertensive, they are prescription only drug. Example of anti-diabetics, you have your metformin. Then anti-hypertensive, you have your lisinopril and amlodipine. Then come to the other part of it, which is the controlled only drug. Controlled drug. Under controlled drug, we have drugs that are strictly under control. Okay, it requires close monitoring as well. Strict prescription and close monitoring as well. So don't forget, the prescription drug requires the doctor prescribe, and it must be given by a pharmacist, a licensed pharmacist. Same also with that of the control drug. The doctor must prescribe, and also given by a pharmacist, and also there should be someone who monitors how it is administered. Okay, so that is how strict a control drug is. Example of the control drug include your morphine, your ketamine, and other strong controlled substances. Thank you.
or a task. Now, the task is this: list 5 drugs and classify them under 2 categories. You get it? I repeat, list 5 drugs and classify them under 2 categories. So that is number